Good afternoon, friends. Thank you for joining me on Let's Chat. As I begin this afternoon, I pray your hand will be my guide. Warm my heart, comfort me throughout the day. Amen. I'm so happy to have a guest, a wonderful, smart, and very pretty woman with me today. And I want you to please welcome Carolyn Wilkins. Welcome, Carolyn. And she has some interesting information. You're going to love it, and I love her. And it's all yours.
I hope so. It's National Nurses Week, month. And so Judy thought it would be nice to have a nurse to kind of talk about some things about nursing, especially nursing in the past.
Exactly.
So I'm going to start with reading. I have one of my books from my nursing, and I'm going to start with the Florence Nightingale Pledge. And this is the important part because all nurses started, Judy, with Florence Nightingale.
Good.
So the pledge is, I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. Now there's more to it than that, but I'm not going to go into the whole thing.
But that is very nice. I like that.
Yeah.
That's very nice.
So
take us back to when you were 18 and you were going to become a nurse.
I've just turned 18, Judy. I mean, I had my birthday in August and I went into nursing in September.
Okay.
So I was quite young. I did it, and it's a 3-year program. I did my nurses training at Deaconess Hospital, which was in Clifton, at Clifton and Straight Streets, right across from the university. This was a very small hospital compared to Good Sam, Bethesda, and those other hospitals. But most of your nurses came out of hospitals. Most of your bigger hospitals had a nurses training program. There were BSN nurse graduates from universities, but more of them came out of hospital, 3-year courses. And then many people who took the 3-year course would go on and take another 2 years to get a degree. So that's kind of the way it was back then. Now this was in 1957 when I entered nursing. And you have to take a test before you can even get into a school.
Wow, well, we hope so.
Yeah, you have to take a national test. It's the same for everybody. And you had to pass the test to be able to get into the nursing school, any nursing school. My stepmother at the time did a lot of private duty nursing at Deaconess Hospital, and she was the one that got me interested into applying there. So that's where I went. So it is a 3-year program. I have a few notes here that I can't remember everything, Judy.
There's a lot, yes.
Okay. This is a 3-year program, and it varies from, well, let's start with the beginning.
Yes.
Okay, the first day, you go over there. This is your orientation. They show you around. They show you around the hospital. They show you around your dorm. We did have a dormitory, and they do all that. And then they take you, maybe the next day, 2 or 3 days in, you go and you get measured for uniforms. And one of the funny things, which I was not expecting, here comes this guy, and he says, I'm going to measure your feet. Measure our feet, and he was measuring our feet because we all had to wear the same kind of shoes.
Sounds good.
We wore the same uniform and we wore the same kind of shoes. And they were white Oxfords. So you couldn't go out and pick a pretty pair of shoes out. You all had to wear the same. So that was the beginning. And then as you moved on, you went through different things. The first 6 months was mostly classroom. We did go on the floors, and we wore our little uniforms. We wore no hat, the uniform, but we didn't wear a bib. It was a blue underdress, a very, very stiffly starched apron, bib, cuffs, and collar.
Wow.
And they were all detachable.
Oh, wow.
So you had to put together your uniform every morning before you went on. Fortunately, they did clean and iron our uniforms in the hospital.
And so you had to do that yourself? Or did they clean them for you?
Oh, they washed everything and starched everything. We didn't have to do that.
Thank heavens.
No. So that was we did that for the first 6 months. You didn't have the hat or the bib. You were a probie. That's what they called us, probies. We were learning, and most of it was classroom. And we had different instructors for the different parts of the things. You had things like We had our director of nursing.
You have your yearbook here in
Yeah,
front of
director
you.
of nursing. We had somebody teaching us, like this is sciences. This lady taught us chemistry, anatomy, physiology, microbiology. We had a psychology nurse. We had obstetrics. We had all kinds of things. And you had to learn, you had to go through all these classes. Now, some of the things we didn't have at our hospital because it was small. So we only had really medical and surgical patients. So we had to go on out to different hospitals, usually for 3 months, to learn these other things. Like we would go to Children's Hospital for pediatrics. We went to Bethesda Hospital for obstetrics. We went to Longview. Have you ever heard of Longview?
Yes, I have.
Longview Psychiatric Hospital. We did that for psych. And another one that a lot of people haven't heard of is Dunham Hospital. That was a TB hospital.
Oh, no, I hadn't heard of that.
It's still there.
Is
it's
it?
used for other things now. It was over on the west side of town. So it was kind of interesting because these were usually 3 months long. And that's how you learn about all these other types of nursing.
Right.
Excuse me, a little frog in my throat today. So let's start out with the beginning. So we were mostly in class. We did go on the floor, and we had some really fun jobs. Washing beds, washing mattresses, gut work is what I call it, because we really weren't trained to do much else. So that was in the early days, but we at least got on the floor and we had our little uniforms on, and we would maybe help feed patients or, do things with them that weren't medical really, comforting type of things. And then as we got further along, after 6 months or so, we'd been in all these classes, we're learning all these things. We've gone into clinicals where we actually practiced on each other how to do things. We learned how to give shots by using an orange. So we would dart our syringe, our shot into an orange until we were really good. We didn't practice on each other for shots, but we did for other things. And we learned a lot by then. And then we were ready to actually go on the floor and do more. Now this is the part to me that is the most fascinating. Back then, we did not have disposables. There was no plastic. There was only rubber, glass, things like that. So your IV bottles were glass. Your syringes were glass. Everything was either paper or cloth, really, and stainless steel and stuff. So what we had to do was we had to autoclave everything because that's how we sterilize things.
Right.
Now these autoclaves were huge, big washers and steamers they were in high temperature. So when they came out of there, they were pretty much sterile. So everything had to be washed, dried, wrapped, and autoclaved.
Wow, and the nurses had to do all that.
We did have some workers who did things like bedpans and stuff like that, and bedpans were metal back then.
Wow.
Everything was either metal or glass. You just didn't have plastics. So our IVs were rubber tubing, glass bottles. Syringes were glass. You had to wash them and clean them. Then the needles had to be, we used to take them over a piece of gauze like this to see if they had burrs, because you didn't want to give somebody a shot with a needle that was going to hurt, right? So we had to file the burrs down to make sure the needles were sharp.
Oh, okay.
This is all very time-consuming.
Yes.
And we did that as nurses, as student nurses. We had to do that. And so, there was that fact that we didn't have any kind of plastic was just a tremendous amount of work. It had to be done.
Like a lot of work.
We didn't have all the fancy things you have now. We took that time to clean products and everything. So that was really interesting. I think that especially like when you got onto the floors and we actually started nursing on the floors, and that was at the end of, probably close to the end of our second year. We were actually nursing, taking care of patients, passing medications, actually being in charge of a floor. It's a little different situation than it is now. And most of the people here at Otterbein are of an age that they do remember how it was in hospitals back then. And they remember, all the things that they don't do now. Right. So for one thing, we had And we did this as student nurses. Usually in our late second year or into our third year, we would be in charge of a floor, a charge nurse. That meant she was responsible for the whole floor.
Wow. How many on a floor?
Maybe 30 patients, something like that. Patients were 2 to a room. They had very few private rooms. They even had wards with 6 patients in a ward. We went over to General Hospital and they had wards with 20 patients on them. So the charge nurse was in charge of the floor, giving people their directions, assignments, and this and that. Everything was ink on paper. There were no computers. There was nothing like that. You had to write everything. The doctors had to write everything in a chart. I have a picture in here of a chart. This is usually a metal chart with all paper. All the information was in there. Your doctor's orders, your doctor's reports, everything, every day, every hour, what was happening with that patient, all their lab work, everything was in that chart on that patient and in a big slot type. And this was our chart room. Then you had a medical room. And the medical room was where one nurse on each floor was in charge of all medications. Now, this wasn't just pills and things. This was IVs, okay? IVs, shots, and medications. One nurse for maybe 30 patients.
Oh, my goodness. That's
on that shift, which would be, say, 7 to 3 or 3 to 11 shift. Usually we worked the 3 to 11 shift because it wasn't as difficult as the 7 to 3 shift. So this person, to set up her medications, now today everything comes in little packages, unit dose, you know, it's so easy. You just put it in a little cup and the patient takes it, right? No. All the pills and everything came up from the pharmacy. It would have their name on it, but it would be loose, okay, or in a little wrapper of some kind, but not a sealed thing. And we had little cards, little medicine cards, and those, you could have 100 of them. And those little cards, for each medication that patient was getting, would have their name, the medication, the dosage, and the time. QID, BID, a lot of Latin in nursing.
Oh, was there?
We had a lot of Latin words, and you had to learn all that too. Besides nursing, you had to learn the language. And that was kind of difficult for some things, but that's the way it is, and it's still. These words are still the same. They haven't changed. So she would have these little cards that would tell you everything and what time that medicine was given. So you'd have all your little cards, and you had to fill all these little cups. That was our disposable paper cups.
The paper cups. I do remember
that
those.
was our only disposable. Fill all your little cups with their medicine for the different hours of that you were working. And then if it's liquid, we had little glass things. And if it was shots, okay, the medication would come in vials, and then you'd have to fill up your glass syringe with your needle. And we didn't have little caps over those needles like they do now, the disposable things.
Right.
We didn't have all that kind of stuff. So you had to be very careful that that needle didn't touch anything.
Oh, yes.
Because it has to be sterile, right? So anyway, so you had all that. You may have had IVs. And IVs, some of them had medication added to them. Some of them were just water, sugar water or saline or something like that. But back then, you didn't have machines. You know, when you get an IV, you get so many drops per minute or going into your arm.
Right.
And that's all on machines now.
Okay.
But back then, we didn't have machines. You had to count the drops.
Oh, wow.
So you had the right amount of drops because you didn't want too much to go in at a time.
No.
So you had to count the drops. Then you had to go back and recheck to make sure it hadn't, the drop thing hadn't changed.
Exactly.
You have to check them to make sure because you didn't want them to get too much, too fast.
Well, no, of course
it would
not.
be.
Yeah.
Any questions?
That is so interesting, yes.
But these are the kind of things that we had to do. The operating room. So
tell us about
entirely
that.
different. Oh my gosh. Everything was cloth. No disposables. Their gowns, their caps, their masks, everything was, we had huge big oxygen tanks or gas tanks. They even used ether for OR back then. Yes, you did have an
Is that what made you laugh?
No, that's laughing gas. That's different. But ether was something that they would put a mask, like a gauze mask, over your face and drop ether on it, and that would make you go to sleep.
Okay.
And they didn't use that too often. They used that, I think, for, at my hospital, the only pediatrics we did were tonsillectomies. And they did, I think, use ether a lot on kids. It was safer than the gas. Because back then, anesthesia was still pretty primitive, really. I mean, you know, they say most people who die when they're having surgery don't die from surgery, they die from anesthesia.
Well, I've heard that, yes.
Yeah. And back then it was even more difficult.
So, yes.
Yeah. So,
so you worked in ER for
Yeah, you had to go
time?
through ER. You had to spend 3
did?
months there, just
Okay.
like you did all these other things. You had to spend 3 months, so you learned how. And doctors were gods. Oh, we had to treat them so well. And
It's kind of the same thing today.
They didn't have to treat us nice, though. You'd get pinched with a hemostat every now and then. But, you know, we had good
we're all
doctors.
young, pretty
we had
nurses.
good doctors. We had bad doctors. But, yeah, it was very primitive. We didn't actually... Not too much, actually, where, you know, you're doing a surgery and you have a scrub nurse and you have another nurse. But we didn't do scrub nursing too much. You learned a little bit of it, you know, but we didn't get into serious big things. Maybe things like people doing hemorrhoids or something like that.
Did they keep men and women separate?
In the
wards?
In the rooms.
In the rooms and wards,
yeah,
they're
the wards.
separate?
Yeah, you wouldn't have men and women in the same
Okay.
ward. It would be all the same
Now,
sex.
I didn't know that. I figured
Yeah.
that's true, but,
Yeah.
what did you, what contact did you have with the patient themselves, besides all this other work you had to do?
Well, you, as a head nurse,
Yeah.
you did go make your rounds when you came on duty.
Okay.
Every patient, you would go in and talk to them, see how they were doing, talk about their care, what was coming up, if they were going to have surgery or this or that. So you did that. Then you were telling everybody what their job was for the day. You're doing this, your assignment, okay? That was your responsibility as a head nurse for that day. And then anything else that would come up. If you'd have a crisis or something happened, you know, that you were responsible. That was your floor.
So if you had a patient that had an accident, it was up to the nurses to take care of that.
Oh, sure. The nurses, yeah, well, they would call. We had residents at our hospital.
Oh, okay.
We had mostly Filipino residents, and they lived there, and they worked there all the time. So if you had a serious problem, you would call them, you would call your supervisor, you know, you had backup help.
Okay,
It
good.
wasn't just you. But, you know, you had to, just anything that would come up, you were just responsible for the floor, except for medications. So that was a big job, and you couldn't do both.
Oh, I can
There's no way
imagine.
you could do both. So now you had your medication nurse, and she would do all of that kind of stuff. Meals would be delivered. We actually cooked breakfast on the floor.
Really?
Yes.
Now that's
we had
pretty
a kitchen.
surprising.
We had a kitchen, and they would send up part of the food, the breakfast food, and then we would fry eggs and stuff in our kitchen for
Well,
people who wanted eggs boiled or fried or salted. So yeah, we did a little bit of that too. It was different. It really
Oh,
was.
it sounded.
And we could go in there and grab a piece of toast if we needed it.
It sounded like. Oh, now, how many hours? What were your shifts? How many hours?
8-hour shifts.
Okay.
Now most of them do longer 12-hour shifts now, but we did basically 8-hour shifts.
And 5 days a week.
Yeah, 5 days a week. And you had day shifts, 7 to 3, 3 to 11, 11 to 7.
Okay.
So it was round the clock, 24 hours.
Round the clock. Okay.
The hardest shift was usually the morning shift. For people going to surgery, you had to prep them for surgery, you had to give them a shot, shots and this and that before they went up to surgery. So
Right.
that was a very busy time. A lot of doctors visited in the mornings. 3 to 11 was a much quieter time.
They're going to bed for one thing.
Well, they had visitors and stuff at that time of day, and so it was a quieter time. My favorite time, really. And yeah, that was a good time of day. And then nights, according, there are people that are up all night, They're
Well, it
sick.
sounds like you
They're
enjoyed
sick.
it very much, even with all the hard work.
It was hard work, very hard work, but it was also fun. We weren't just doing nursing. We weren't just studying. Our school we had teas, we had dances. They had a baseball team. They had a volleyball team. We did other things.
Oh, good.
And we had a nice dormitory. We shared two persons to a room, bathroom down the hall, one big bathroom. Very nice. When we first started there, Deaconess was a building built in the 30s, I think 40s, in the front. And behind that was the very old building that went way back to like the 1915 or something. So it was very old. And that's where they had a lot of what we call these rooms where they had it was like a big slop thing where people would empty bedpans and all this kind of stuff. And I mean, I don't even want to go into that.
Oh, we want to hear all of it.
But they had a little chapel back there and everything. And we had a couple of, the hospital's name is Deaconess because we had two deaconesses, which were ladies. They weren't Catholic. They had started a hospital in Cincinnati, downtown Cincinnati.
Okay.
And then they moved into this bigger hospital in Clifton. And we still had two deaconesses that lived there.
That's interesting.
Yeah, that lived on site
I always would have thought deaconess would have been men, but they were women.
They were women, yeah.
And they started
I have
this
some pictures in this
Yeah,
book of
please
them.
show us what you have there that Kevin can kind of zero in on a few things.
Well, let's see if Kevin can do this for us.
Oh, that's good. I love that
She
one.
wanted me to show. Which one is it, Kevin?
Which camera?
It'll be the other one.
This
Right
one?
across from it. Yeah, give me just a second. Hang
And tell us about that picture and what row are you in?
Oh, you'll never know it's me.
I know which one. She's in the front row.
I don't know. I don't think he's doing it yet.
There we go.
There we go. Okay, this is my class. We graduated in 1960. This was in, we had already gotten our caps and everything, so I think this was in our second year of training that this picture was taken. So I'm in there. I'm in the front row.
Now, do you get a diploma when you graduate like college kids do? Is there like a diploma type
yeah.
thing?
You get a.
What is this?
And this is the deaconesses.
Yeah.
I don't know if he wants it. Up in the corner there, they're the little deaconesses. Am I doing it right there? We still had two of those living. This is a picture of our hospital.
Oh, that's good, yes.
That's in the front of our book. They didn't do these books every year.
Oh,
Very seldom did they actually do them. I was very fortunate to be in there at the time when we
Yes.
did one, and I was on the committee, so there's lots of pictures of me in here.
well,
But it was a small school, which made it better.
oh yeah.
I think when
And
you
you
get
got
into,
to know the other
Yeah.
girls better.
Oh yeah, everybody knew everybody from all 3 years, and it was just besides we got to go out to all these different places, to study the different
Yes.
things, and that was
Yes.
very interesting. I loved Longview. I actually did psychiatric nursing after I graduated for a while because I really liked psychiatry. But
The one thing I love is the white hat. Did you touch on the white hat?
this is our.
They don't
this-
wear these
I
anymore.
haven't had this hat out of the bag for probably 50 years or more. But anyway, the hat. Where am I? I don't know which one he's doing.
Look straight ahead,
This
I
one
think.
here. Okay, the hat sort
Isn't
of goes
that
like
wonderful?
this. And the wings fanned out like
I
that.
wish you'd go back to wearing them.
It's gotten really stiff over the years.
I know, but it's.
But you had to wear a full uniform. Clear into the 80s, we were still wearing white uniforms, white hose, white shoes, maybe not a hat. They did stop hats earlier, but you
Why
did
do
wear
you think
uniforms.
they stopped wearing the hats?
I
Because that
think
really
they got
told
in.
us
I
who
think
you
they
were.
got in the way.
Oh, did they?
sometimes,
Did
yeah.
they?
It's depending on the kind of hat you had. Some people had big hats.
Oh.
Some people had little tiny hats. They were all different for different schools,
Okay.
and people would recognize where they went to school by their hat.
By their hat.
Yeah. So
Well, I love the hats. And I wish they still wore the hats.
They were cute. We liked our hats. These were very traditional hats. You saw a lot of people with wing caps like that.
You might not like this, but
What?
the hat makes me think of
I know the show.
which show?
That one where the flying nun.
Oh no, I'm not
that's
thinking
the
of the
one I'm
flying
thinking
nun.
of, too.
No, I'm not thinking of the flying nun. I'm thinking of might be a little bit more offensive, which is One Flew Over the Cuckoo's Nest.
Oh, yeah.
It makes me think of Nurse Ratched.
Yeah, she wore a hat, didn't
Yeah.
she? Oh, she was a really staunch, and we had some like that.
Uh-huh.
We
Oh,
really did.
I'm sure you did.
So
I'm
not, a lot of nurses were business. It was all, strict. You had to be very strict. But so there might
Well,
be
I love hearing all this because I was not a nurse, so I didn't know any of this.
No, and we have a lot of nurses. I call them old nurses.
Yes, old nurses.
Some of them my age. Some of
You
them
ought
a
to
little
start
younger.
a nurses organization here of old nurses.
I
old
thought about
nurses.
getting together and
Yeah.
just
Have
talking,
lunch.
reminiscing, like who
Yeah,
went to
I
what.
think that'd
I
be-
went to Christ, or somebody went to Christ, somebody went to Bethesda, somebody went to Jewish. They went to all these different schools.
I want to come to the luncheon. I want to meet all these
Well,
nurses.
after we graduated, we would get together, and the hospital actually had luncheons for us, and that went on for quite a few years. And then, of course, they got rid of the hospital, and we didn't do it anymore. But we would also, our class would meet. And now I don't even know that there's very many of us alive anymore. A lot of people
Yeah,
have passed
that's true.
away.
That is true.
And there's only a couple people, my roommate, and maybe one other person that I even talk to anymore.
Mm-hmm.
It's kind of sad, That's why I want to get together with this gal that graduated. I'm sure she was a senior
You'll
when
have
I
to
was
find
a
out her
freshman.
name.
I saw her at one of the outings we went to, and I forgot her name. But I was looking at all the pictures, and I decided who she might be.
Since we're talking about you a little bit, tell us a little about your family and where you live here and how long.
Well, my husband is Mike. He's the English
And he's
shuttle driver.
Yeah, he's a shuttle driver
He's
too.
a shuttle driver. And we've been married almost 38 years. He's
Wow.
second marriage for both of us. I have 4 children. He does not, but he's grandpa to all
He's
my
great.
grandchildren, great-grandchildren. And we even have two great-great-grandchildren.
Oh,
You
that's-
wouldn't believe that, would you?
You don't look old enough for that, for sure.
Not too many people have great-greats.
I don't.
Yeah,
I don't.
so yeah, we do. There are not a lot of them, but we just have, it's nice. This happens, when an 18-year-old gets pregnant and then their children get pregnant at 18. That's what happens, and that's when you get great-greats. But anyway, we met here in Cincinnati. Mike came over from England for working here for an English company, and we met at a singles club back in the
Those work, huh?
yeah, and my first husband had passed away quite a bit earlier than that. So we met, and we dated off and on for about 3 years, and finally got married.
Good.
So,
How long have you lived here at Otterbein?
we've been here 7 years.
7 years.
Yeah, we lived different places. We first lived over on the west side of town, and then moved over to the north side. We lived in Mason at Heritage. Well, actually, it was Mainville, Heritage at Miami Bluffs. And there are some other people from that community. That was an over 55 community.
Okay.
So we have several people here from that community.
Interesting.
And I just met one, or I'm going to meet her tomorrow, because I'm on the welcome committee.
Oh.
And I called her and was talking to her. She's a nurse. And she said, I used to live in, what did I just say?
Mason or
No.
Mainville.
Mainville. Yeah. I used to live in this community. And I said, well, I lived in that community, Heritage at Miami Bluffs. I said, what street did you live on? And when did you live there? Well, she lived there at the same time I did.
Isn't that
But
something?
I didn't know
You just
her.
never ran into
No,
her.
didn't
What
know
was
her.
her first name?
So I'm looking forward to our chat. Her first name is, she's Karen. And don't ask me her last name. But she's Karen. Her name is Karen.
How long have you been on the welcome committee?
A couple of years.
Couple
after
years?
COVID, yeah.
They
we got it.
visited me when I moved here, and I have really appreciated
Well,
it.
we have a nice bag of goodies for them.
Yes,
Very
yes.
nice. I mean, they get a free haircut and hairdo and all that kind of stuff. So, yeah, it's very nice.
Yeah, that's
So
really
it's
a
fun.
nice
It's
thing.
not overwhelming. I'm also Mike does other things. He's a helper. He helps everybody in the neighborhood.
sure
He
he
is a big
Well,
helper.
he worked in the library, or does.
He works in the library. He plays golf. He's on the things that does the Echo, where they pick the person of the
Spirit Award?
Yeah,
Spirit
he works
Award?
there.
I
He
don't know
does
what that committee is.
Yeah,
but-
he does a lot. He does more than I do.
We tried to get him to come on, but he said no. But she said he had a very interesting life.
Very interesting life. You could take an hour with him, easy.
We can't. Kevin, can you talk him into coming?
I'll see what I can do.
I don't think he will.
I've asked him a couple times, and he just says no.
And it's funny because he does like to talk.
He's not shy.
No, he's not shy. He does like to talk.
Right.
But, that's what impressed me.
Maybe after he sees yours, he'll say, oh, yeah, that wasn't so bad. Maybe he would do it.
Well, my memory's not so good. I probably didn't even talk about a lot of things.
Oh, you did. You did great.
You can't talk about everything.
You highlighted all the important things.
Yeah, it was interesting. And I just think it's interesting for people to see how different, not that long ago, really. I mean, to me, it's not that long ago.
No, not really.
From just in 1 year, from like, say, 1957, when I went in, to 58, 59, all these changes happened in like 1 year. We started getting all these disposables. Not everything, but a lot of things.
Do you think it was so much cheaper to go disposable or more expensive? It sounds like it'd be more expensive to buy all that plastic.
It may have been more expensive, but it was not the labor intensity.
Not as many nurses available.
Not so much nurses as all the people that clean all this stuff,
Yeah.
wrap all this stuff. When we did gloves for surgery, you took the gloves, we washed them, we turned them inside out, washed them again. You'd blow on them to make sure there were no leaks, because there couldn't be any leaks.
Oh, yeah.
And we actually blew into them. They were going to be autoclaved anyway. Blew into them, powdered them, wrapped them up in a cloth napkin, and then they would be sterilized. All that for one pair of gloves, Kevin.
So when you graduated from nursing school, did you then work for Deaconess Hospital?
For a while.
How long?
For a while. Actually, when I graduated, I was married already, and I was pregnant when I graduated. Not showing, because we weren't really supposed to be pregnant. But anyway, so I worked, I guess, until I had my baby, and then I didn't go back to Deaconess. The next place I worked was Good Samaritan, and that's where I worked a lot. Really.
Okay.
Yeah.
My mom went through that Deaconess program as well, nursing program.
Wonderful.
She was a graduate of there.
When did she do that?
So that's why I was asking. She would have been early 80s. She would have graduated, yes.
Yeah, I'm not even sure when they stopped the program there.
Not too much longer after that, because from what I understand, so even though they were down in Clifton, she would have to go to Xavier to take general education classes.
Oh, really?
So even though they were located down in Clifton next to UC,
they went all the way to Xavier.
Their general classes they had to do at Xavier. And so then from what I understand, eventually the program essentially moved completely over to Xavier, and that became the start of Xavier's nursing program.
Oh, so they stopped the UC, then it went to a 4-year program, a degree program.
Well, I don't know. It might have still been a 3-year program, but Xavier was running the whole thing.
Okay.
Deaconess essentially folded the program, and it got warped into, it got absorbed by Xavier and was the start of their nursing program.
By the 80s, I really had not done much of anything at Deaconess anymore. And then I think they tore it down, actually. What they've built now is something else. I don't even know what it is.
Yeah, I don't know either, but it's a running joke in my family because every school my mom attended no longer exists. Her elementary school went away. It got bulldozed. Her high school was absorbed by Purcell because she had gone to Marion, and now it's Purcell Marion, so it got absorbed.
Oh, wow.
And then the Deaconess program went away and got absorbed by Xavier. So it's a long running joke that when my mom goes to a school, they then destroy the school when she leaves.
I can remember in the winters, we were at Straight Street, which is, if people don't know, it's a very steep hill that goes down off of Clifton Avenue. Very steep hill, and that's where our hospital was. And they had to close it off because cars couldn't make it up or down. So we would get trays from the cafeteria and go sledding down Straight Street. We had fun.
That was fun.
That was fun. Yeah.
Did you, sorry, I'm thinking back to my mom and some of her experiences. Did you have to dissect a cat during?
Yes, we did.
Now,
we did cats.
Where did you keep that cat?
Not in our room.
She had to keep it in her dorm room.
No,
You're
we did
kidding.
not.
Yes, she
No,
did.
they kept them, I think.
For how long?
For I think it was a couple weeks or whatever that you're, or
Yeah.
you know.
You didn't have to refrigerate it or anything?
I don't know if they gave them an individual refrigerator or something, but it was in the room.
Well, they used the stuff they used on them, to keep them
Oh, to keep them from smelling?
formaldehyde
Yeah,
or
the
whatever
formaldehyde.
it was.
Mhm.
They may not have had to keep them cold. The formaldehyde probably preserved them.
I can't-
'cause they smelled really bad.
Yeah, either way, it's a horrible smell. Even if it's just the formaldehyde smell, it's
Yeah.
horrible. But I remember her telling me, when I did it in high school, in an anatomy class, she said, well, you're complaining about that smell. Imagine trying to live in that room. And I was like, what are you talking about?
We didn't. No, we did not have to keep
Okay.
them in our room.
Too bad we didn't know about your mother. We could have had her on together.
Yeah, she could have come on the
'Cause
show.
these
She's
two
here
would have had
another
lots of
20 years
compared
later,
news. Yes. Yes.
Yeah.
Small
No,
world
that's
moment. I
interesting.
love it.
Yeah.
So
yeah.
that's very,
Deaconess,
did she have a white cap?
Probably.
Ask
her if she
No.
still
No,
has her white
the
cap.
hats went away in the 80s.
Yeah, I don't know that she ever wore the hat. No,
Oh.
yeah.
And the black band you see on the hat, now this is a graduate nurse, okay? But when we were students, we had little stripes on the side. So the first year was 1, second year 2,
Oh,
the third year
okay.
would be 3 little stripes. So they could tell what grade, what area, if you were
Okay.
getting up there to graduation. And everybody had to take a state board
Okay.
test, which was very difficult. When we did it, it was 3 days. We had to go up to Columbus to take the state boards. And it was 3 days, and it was in sections for each area, like medical, surgical, obstetrics, psychiatric, all sections. And a lot of people didn't pass. It was difficult.
very difficult.
Very, very difficult.
Difficult.
But you only had to retake the area you failed in.
Oh, well, that
not the whole
that
test.
was good. Yes.
But you had to do that. And Ohio is pretty good because they reciprocated in a lot of other states. Some states like Mississippi, Missouri, didn't have much reciprocation. So if they would go to another state to work, to live, they would have to take that test over.
Oh, wow.
Yeah.
That would be hard.
Yeah. I think there were a couple of states like New York and California that reciprocated everywhere in the United States. But
My son teaches at East Tennessee State, graduate, and he's teaching nurses.
Oh.
And his biggest thing is he will not permit any type of cheating because you have to know this.
You have to know what
And
you're
I looked
doing.
at some of his tests and I couldn't even read them. I
Well,
couldn't even read them.
It
They were
wasn't
so
easy,
complicated.
especially when you got into breaking down medications. Medications didn't come, like for children especially, they didn't come in children's sizes and
Oh, yeah,
dosages.
that's
You had to
true.
break these dosages
Really?
down. So we had to learn a lot of that was
Yes.
mathematics and
Yes.
how to do all that. And that was hard for a lot of people.
Well, you probably did a lot of tonsillectomies on children.
That's the only children we did at Deaconess
Okay.
was tonsillectomies. And they were not very nice because a lot of these children would bleed after a tonsillectomy. And we had some serious hemorrhaging from tonsillectomies. But they only stayed there 1 day. Back then, if you had a baby, you stayed a minimum of 3 days, sometimes longer.
Yes,
Yeah.
yes.
And even when you were normal, you were fine. There was nothing wrong with you. You hadn't had a C-section or anything. So, but now we don't even go to the hospital anymore. If you're going to have surgery, it's
A taxi
outpatient.
handy.
So things are different. The average stay of a patient, I would say, in the hospital for a disease or a surgery would be a week.
Yeah.
That's average. Some people
Average.
stay much
Well, now
longer.
you get back surgery or something big, they want to send you home that day.
I know.
You
And that's
can-
better for
You can
you.
stay a day, but they want you out of there.
It's better. I remember when they were first doing cataract surgery.
Yeah.
These people that was major surgery. It was new. We would have sandbags next to their head so they couldn't move their head. They could not get out of bed. They could not use the bathroom. You had to use a bedpan. You had to be fed. This was how primitive these things were back
Yes,
then.
yes, compared
And
to
now
today.
it's nothing.
No, nowadays it's not hardly anything.
So, you know.
Well, it's been really great. I don't want to cut you off, but if I don't want you to.
It's been fun. Thank you.
Listen, I loved
appreciate
having
it.
you. You
Thank
were wonderful.
You so much.
And
Thank
I
you,
know
Kevin.
all these non-nurses.
It was interesting to hear about your mom.
Yeah, absolutely.
That was
And
great.
we heard from Kevin over there too.
Yeah,
so,
great.
I don't think I have. Would you like to say goodbye to our audience?
Well, thank you for having me.
Goodbye, everybody.
And I love to talk, as you can tell.
And I love it. That's what we want as talkers.
And I love seeing two of my morning announcers
Yes.
sitting here talking amongst themselves.
That's how we
He
got the
trained
job,
us.
because we
That's
love
great.
to talk.
Love it.
Goodbye, everybody. Hopefully see you on the next talk show.
Bye-bye. Thank you.
Bye-bye. That was wonderful.
Is it okay?
Oh, it was wonderful. I